I had wanted to be a doctor since I was in high school or younger. I had a family member or friend of the family who was a great mentor early on. He was a pediatric general surgeon, and it's just always been in my blood. I think that for some of us, it's not a decision we make later in life, but just something we grow up with. It's my passion, and I don't think there was ever any thought that I would do anything else other than go into medicine. So my course to ophthalmology is a little bit unusual. I really, in medical school, wanted to be a pediatric general surgeon. And through medical school, surgery just wasn't for me, or at least the surgical environment wasn't for me. So I went into pediatrics and loved general pediatrics, practiced as a child abuse pediatrician, but I missed the surgical world. And as I was immersed in the pediatric world, I learned that pediatric surgery was pretty fun and an interesting opportunity, and the eyes were fascinating, and one thing led to another. Through some mentorship and some collaborations, wound up coming over to ophthalmology and adding that on. From the moment I interviewed at Wills, I knew I was going to be a pediatric ophthalmologist before I even interviewed, and that pathway just kind of formed itself, bringing together the two aspects of my training, and I'm glad I made that decision. It's worked out very well. Ocular genetics is really an emerging specialty in ophthalmology. There's only maybe 70 or 80 of us in the world. It really brings together my interest as a pediatrician to my interest as a pediatric ophthalmologist. And we're really rare disease doctors. We spend every day seeing very unusual disorders, trying to help families understand what they have. And then knowing what they have, that helps the family in so many ways: counseling, support groups, pathways to treatment. Many different aspects of their lives are impacted by this knowledge. I've seen families and individuals who've gone 30, 40, 50 years of their life always wondering, what is it that I have or my child has? And finally getting an answer is extremely empowering. Very satisfying area. I love what I do. I love coming to work every day and solving these complex problems. And that's really become the focus of what I do, that and pediatric cataract and pediatric glaucoma and inflammatory disorders of the eye. So ocular genetics here at Wills Eye is based on a team approach, as it is at most places. We have a full-time ocular genetics counselor. We have a fellow and other trainees, a research component, a teaching component, and really we're a referral service for places around the world where people come with their rare disorders to try and get help, to try and get solutions, and the very basic, try and get a diagnosis. We collaborate with centers throughout the world, laboratories, researchers, other clinicians. We share cases. We now have fellows that we've trained who are all over the world, many of them the first ocular geneticist in their country. We have a listserv where we continue to collaborate and help each other diagnose cases. Being a very small group, it requires that we all work together to help each other out and help each other along the way, making new discoveries of new genes and new diseases, and at the same time helping the patients right at the bedside. It's really a great example of bringing the laboratory to the bedside and bringing teamwork to individual patient care. So I always say pediatric ophthalmology is by far and away the best specialty in ophthalmology. With all deference to my colleagues, we take care of every part of the eye. So we do the glaucoma, the cataract, the retina, the cornea. We're involved in every aspect of the child's care. And we're also dealing with patients who are going to live another 100 years. So whether they have strabismus, eyes that are misaligned, need patching of one eye for something as basic as amblyopia or lazy eye, up to the more complex problems, we're there solving problems that will give this child vision for another 100 years. We work with families. It's a family approach to care. And I have the joy every day of getting paid to come to work and play with toys and kids, to work with individuals, the parents, who care about nothing more in the world than their child, my patient. I've got a partner in their care. It's a wonderful environment with a wide range of pathology, with long-lasting impact. It's just simply the best. Why Wills Eye? I was in Canada for many years, and I got a call from Julia Haller, an inspirational chief. To come back to Wills, where I trained, come back to my roots. Really hard to say no to that offer. What a great place with great people, family, so many people that are here that I trained with, I've known for years and years, mentors, teachers, collaborators, in an environment that's just so rich, so wonderful. You need a retina specialist, they're right next door. You need a specialist in anything, they're right next door. You need a piece of equipment, it's here. It gives me the opportunity to practice the highest level of ophthalmology with all the resources I could ask for in a supportive environment, really leading the country, leading the world in many ways. Wills Eye is at the forefront. Just a great place to be, work with good people.